Teeth are a very important part of our inner and outer personalities. For good health, the teeth also need to be healthy. For most people, dental health is the last priority. They're not even aware how to take good care of their teeth. So first, let us get introduced to our teeth and gums.
You can divide me into two parts, crown and the root. Crown is the part you can see in the mouth, but the root is not visible. It is hidden inside the jaw. The outermost layer of my crown is called the enamel. This is the strongest element in the entire human body. The yellowish layer below the enamel, which looks like bone, is called the dentin. The dentin surrounds the vessels and nerves of the teeth, called as pulp. These blood vessels supply food while the nerves carry sensation to the teeth. Okay, let me show you how we work. We are the frontal teeth. 4 of us grow on the upper gums and 4 in the lower gums. We are called the incisors, and our job is to hold and cut the food into pieces. We live in the corners of the mouth, and our job is tearing and shredding the food. We are called the canines. More than the humans, we are useful to the carnivorous animals. My twin brother and I are neighbors to the canines. We emerge on both sides of the jaw. 2 of us in the upper jaw and 2 in the lower. We are the premolars. Our job is to hold the food tightly and chew it. Adjacent to the premolars are we, the molars. Our bigger chewing surfaces, with their grooves and cusps, crush the food and make it digestible. Even we are called the molars. Since we erupt between the age of 18 and 25 years, we are also called the wisdom teeth. There are 2 dentitions in human beings. First, during the childhood, when we are called the milk teeth. We do the job of chewing and helping in the development of jaw and permanent teeth. We start emerging in the infant's mouth at the age of 6 months and grow fully by the age of 2.5 years. In both the jaws, there are 8 incisors, 4 canines and 8 molars. A total of 20 teeth, but all temporary. When a child is 6 years old, we, the first permanent molars, emerge from all 4 sides of the jaw behind the milk teeth. Gradually, the entire temporary molars and the milk teeth start falling, and by the age of 12, permanent teeth emerge in place of milk teeth. By the age of 12 to 13, a second molar erupts behind the first molar, and the third and the last molar emerges by the age of 18 to 25 years. Our strength then goes up to 32. The teeth are attached to the jawbone, which is covered by the gums from outside. Gums give strength to teeth.
Over the last 50 years, dental diseases have been rising in India. Nearly 80% of children and 60% of adults are victims of dental caries. Up to 90% of the population has infection in the gums. 30% of the children have irregular teeth, and 35 to 40% of all cancer cases are related to the mouth. The reason behind these shocking figures is the excessive consumption of tobacco, betel nuts, pan masala, liquor or gutkhas.
Namaskar. I am Ajay Roy Chaudhary. Let us talk about dental diseases. There are mainly 4 main types of diseases that harm our teeth: tooth decay or dental caries, inflammation in the gums or pyorrhea, irregular teeth or malocclusion, oral cancer, and precancerous conditions. Let me tell you more about these diseases and how to protect ourselves from them.
तू प्रेम दा प्याला पी आया है तेरे दिल विच की आया सारी मधुशाला पी आया एक पल में सदियां जी आया मैं पी आया मैं पी आया मैं पी आया जा पी आया मैं जी आया
खाना आज बहुत अच्छा बना है। तुमने बनाया है?
मैंने नहीं पापा मामा ने
क्या खाना आज वाकई में बहुत अच्छा बना है? पर पहले तो मैं रसगुल्ला ही खाऊंगी।
Is your tooth sensitive to cold, hot, or sour food articles? There might be holes in the teeth. It could be dental caries.
This is an advanced stage of dental caries. Both the lower molars of this person are entirely infected. Now, no treatment is possible. As the teeth are completely infected, even the roots have accumulated pus. This disease can attack both adults and kids. Initially, this disease starts as a black or brown stain that gradually grows to make the tooth hollow. In this state, any hot, cold, sour, or sweet food articles can cause sensitivity of teeth. At this stage, treatment is possible. This decay is mainly found in the chewing surface or between the back teeth. That's where the food usually gets stuck. During the night, if infants are left for a long time with the milk bottle in their mouth, that can also cause dental caries. This is a peculiar kind of caries. In this disease, the upper frontal teeth and the lower back teeth are completely destroyed. While drinking milk from the bottle, the tongue covers the lower front teeth, so they remain protected to an extent. This infection is called the nursing bottle caries. If dental caries is left unattended, it may lead to abscess. This abscess appears as swelling in the gums and could spread to the face and the neck. This could result in fever, excessive swelling, and sometimes become fatal.
Most of the people feel that these are only milk teeth. They have to fall anyway, and the new teeth will anyway grow. But that's not true. If these teeth fall much earlier than normal, because of bacterial infection, there could be trouble with the growth of new teeth, and this could also lead to malocclusion. What is the cause behind dental caries? Actually, there are a lot of tiny bacteria in our mouth. When these bacteria come in contact with the food remnants stuck between teeth, they produce acids. These acids make holes in our teeth.
This is not treated in time. The decay will progress and cause cavitation in enamel and dentin. At this time, there can be sensitivity to hot, cold, or sour. If the disease progresses further and reaches the pulp, it causes pain. Once pulp is infected, it can form abscess below the root of tooth, swelling, and involvement of jawbones.
But if the patient approaches a dentist, the doctor can treat these cavities with a special kind of filling made of silver amalgamation or composite. And your teeth can be protected from being totally destroyed. Now let us know about another dental disease, the gum disease.
Bad breath could be pyorrhea.
This man is suffering from infection of gums. There is a black-green layer of tartar which has led to the swelling of gums. Even a slight touch or while brushing, the teeth start bleeding. Healthy gums are coral pink in color. Normally, while brushing, they do not bleed. If it bleeds, that's the first symptom of infection. If enough attention is not paid, gradually the corners of the gums become red. They start swelling and bleed even at the slightest touch. Gradually, the gums lose their grip on the teeth and the roots of teeth become visible. If this situation is not treated immediately, the infection could spread to the bones and may create pockets around the teeth. This stage is called periodontitis or pyorrhea. In this state, the teeth are extremely sensitive to hot and cold tastes. There is an itching sensation, slight pain, and foul smell from the teeth, and gradually the teeth start shaking and ultimately fall off. Infection of the gums could also be caused by accumulation of plaque on the teeth. If this plaque is not cleaned in time, it hardens to become tartar. This means more bacteria in the mouth, which causes inflammation of the gums and itching sensation.
If there is plaque or accumulation of tartar, the dentist can clean it using special instruments.
If the infection in gums is not treated in time, the bacteria spreads beyond the gums and could affect the underlying bones. This could lead to pus formation, foul smell, gums losing their grip on teeth, and ultimately loss of teeth. After scaling the tartar, plaque also gets cleaned and teeth breathe fresh air.
Let me repeat. The reason for dental caries and gum disease is the accumulation of plaque. Therefore, it is very important to protect your teeth from plaque. The best way to protect your teeth and gums is brushing your teeth with toothpaste, toothbrush or datun, or to gargle with water so that no food particles remain in the mouth. The correct method of cleaning your teeth is...
That's not the right way.
Come on, let's see on this model of jaw the correct way of brushing your teeth. The mouth should be wide open and starting from the last tooth, the brush should slowly move upside down, then brush the next teeth, then next, and this way clean up to the last tooth on other side. Now, the chewing surface should be cleaned by moving the brush to and fro in small strokes. Likewise, the inner surface can be cleaned by moving the brush upside down Now let's go to lower teeth. The outer surface can be cleaned by downside up strokes on the lower teeth. The chewing surface of the lower teeth should be cleaned similarly by moving the brush to and fro in small strokes. In this manner, the teeth are cleaned from inside by moving the brush upwards. After this, rinse your mouth with the finger, massage your gums, and clean your tongue.
Frequent intake of sweets and sticky food products could lead to dental caries. Do not have excessive toffees, chocolates, pastries, and cold drinks. Consumption of green vegetables, fruits, milk, and salad should be more. After eating, clean your mouth properly by gargling so that no food particles are left stuck on your teeth. Infants should not be left sleeping with a bottle in their mouth. After the child has had milk from the bottle, the baby's gums should be cleaned both from outside and inside by using a clean soft cloth. After the child stops breastfeeding, as far as possible, milk should be fed with a spoon. From the moment the infant grows his first tooth, it should be cleaned with a small toothbrush. The bottle-fed babies should be made to drink water with a spoon in a sitting position so that the milk sticking on the teeth goes down the throat. Now, let me introduce you to another dental disease. This is called irregular teeth or malocclusion.
30 to 40% of children suffer from malocclusion or irregular teeth. This may be hereditary, but sometimes habits like thumb sucking, lip biting, tongue thrusting, or breathing from the mouth can lead to this disease. In this stage, there could be too much gap between the teeth or they could be jetting out. The teeth could be abnormally irregular. In this person, the lower front teeth are extraordinarily protruded than the upper ones. The teeth are excessively crowded and have overlapped on each other. This girl's upper incisors are protruding out more than the lower ones. She cannot close her mouth. That is why her gums are swollen and the lips are cracked. The lower teeth are stuck to each other. As her mouth cannot close, the lower incisors are touching the palate, and the palate appears to be much deeper. If we look at the face from outside, it appears to be slanting and bent like an arch.
Malocclusion affects the function, appearance, personality, and psychological well-being of a person. To protect from malocclusion, it is advisable to save the child's milk teeth from cavities. Care should be taken to prevent habits like thumb sucking, mouth breathing, and tongue thrusting. If the permanent teeth are unable to come out, doctor can remove few milk teeth and make space for them to erupt. Irregular teeth are generally corrected by using braces.
Sometimes children get an injury which is not visible from outside, but actually one or both of the condyles which help in opening the jaw can break or get displaced because of the injury. After some time, a bone-like substance can form in between the joint space and around the condyles. This results in contraction in the jaw, problems in the growth of the jaw, and a distorted face.
मुंह खुलता नहीं है, साफ आवाज़ नहीं आता है, साफ चेहरा नहीं दिखाई देते हैं, साफ अब नहीं कुछ खा नहीं पाती हैं, खिचड़ी बना के खाती हैं, रोटी कुछ भी नहीं खाई जाती हैं.
After injury on any part of the mouth, the doctor must be consulted. If a tooth comes out due to an injury, the child must pick up the tooth from the crown, wash it with clean water, and put it back in its place after rinsing the mouth. If the tooth cannot be put back in its place, it can be kept between the lip and the gum, or in milk or clean water so that it does not get dry. The doctor can then put the tooth back in its place. Remember that the sooner the tooth is put back in its place, the better will be the results. Oral cancer is the most dangerous of all mouth diseases. In India, this accounts for a third of all cancers, while in the world it is the sixth most common cancer. According to an estimate, out of every 1 lakh people, 19 suffer from oral and lip cancers. The disease occurs mainly because of excessive consumption of tobacco, pan, bidi, cigarettes, liquor and gutka. Poor oral hygiene and liquor consumption accelerate the growth of this illness. This person is incapable of opening his mouth. This can be an initial symptom of cancer. The inner portion of this person's cheek and the back of his palate are clasped because of fibrosis, and it appears white. As the tissues inside his cheek are also fixed, he is unable to open his mouth. Normally, a person can open his mouth up to 1.5 and 2 inches. But this person can open only up to 3/4 of an inch.
मैं प्रतिदिन 13-14 गुटखा खाया करता था, जिससे मेरे मुंह में तकलीफ़ हो गई और जिससे मेरे मुंह में मतलब मुंह कम खुलता है और मतलब मुंह बहुत कम खुलता है और मिर्च बहुत लगती है, मतलब कुछ खाया नहीं जाता है.
There's an ulcer in this person's palate. This is oral cancer. All his teeth have fallen and the roots have remained inside the gums. Some portions of the left side of his palate are swollen and he's unable to open his mouth. There is a swelling in the lower jaw and there are nodules growing on the left side of the neck.
मैं सिर्फ स्टार्टिंग में पान खाता था. पान के बाद अब करीब 2 साल से मैंने गुटखा पान के साथ अटैच कर दिया था और अब से 4 महीने पहले मुझे कुछ बीमारी का एहसास होने लगा था.
Oral cancer is generally preceded by well-recognizable pre-malignant lesions like raised white patches or plaque inside the mouth or on the tongue. These patches can have either smooth surface or cracks and fissures. Sometimes a nodule can also form on the tongue or inside the cheek or on the palate. At times, deep ulcer that is unable to heal within 2 weeks may also be a pre-malignant lesion. Some lesions on the tongue or inside the cheek are seen as deep red patches with a velvety surface that may be raised or depressed. Inability to open the mouth due to submucous fibrosis is more dangerous than other pre-malignant lesions. This may mean cancer in one or more places inside the mouth. This disease can be caused by the consumption of betel quid with or without tobacco, gutkha, khayni, or even just areca nut.
मेरा मुंह 30 साल से बंद था। मेरे तो पहले सुपारी खाती नहीं बल्कि उसे मुंह में रख लेती थी मैं उसे। तो 30 साल तक खाते खाते मेरा मुंह एकदम बंद हो गया और मुंह में छाले भी रहने लग गए। तो खाने में भी प्रॉब्लम होती, ना मिर्ची खा सकती थी ना नमक की कोई चीज़।
Cancer is a fatal disease. If the disease is diagnosed early, treatment is possible. The case you are seeing, this person has to undergo a major operation of the mouth, and later perhaps radiotherapy and chemotherapy might be required. So the common symptoms that we need to be alert of are ulcers not healing for more than 2 weeks continuously, red or white patches in the mouth, trouble in opening the mouth, trouble chewing or swallowing, numbness of tongue or any other part of the mouth, excessive bleeding of the gums, and sudden hoarseness in the voice. To know the symptoms of cancer, you can check your mouth yourself. Turn over your lower lips to check if there's any red or white patch or swelling-like symptoms. Similarly, turn over your upper lips completely and look into the mirror. Now, you can look at the interiors of both the cheeks in the same way. Now, bending your head backwards, check the palate if there is any ulcer, red-white patch or swelling. After this, saying "ah," you can look inside your throat. Now, turn to check your tongue. Look at your tongue from above, sideways and the below. Any slight lump on the tongue can be a symptom. Similarly, you look under your tongue by raising it. The best way to avoid oral cancer is to stay away from tobacco, pan masala, liquor and other such things. That's because 95% of oral cancer happens due to the consumption of tobacco or gutka. If you find any symptom indicating cancer, rush to the doctor for treatment. Now, you must have understood how important it is to take care of teeth and gums to protect yourself from dental illnesses. Let us have a recap of the oral illnesses and ways to protect against them. There are 4 types of dental illnesses: tooth decay or dental caries, inflammation of gums or pyorrhea, irregular teeth or malocclusion, and oral cancer. To protect yourself from dental caries, prevent sticking of eatables in between your teeth. Do not allow deposition of germs or plaque on your teeth. Do not consume excess of sweet and sticky substances. Do not allow bottle-fed babies to sleep with milk bottles in their mouth. Bottle feeding of babies should be avoided. Please remember, brush your teeth regularly with toothpaste twice a day, once in the morning and once at night before sleeping. Clean the gums of the infants properly after feeding the milk. Babies with milk teeth should be given 1 to 2 spoonfuls of water after feeding the milk. Please remember, when the breastfeeding is stopped, the baby should be fed milk directly with spoon or glass. Consume adequate amount of milk, fruits, green vegetables and salad. If your teeth are oversensitive to hot, cold or sweet, consult your dentist immediately. To avoid tooth decay, do not allow deposition of germs and plaque. Please remember, brush your teeth regularly with toothpaste twice a day, once in the morning and once at night before sleeping. Rinse your mouth properly and massage your gums with the finger gently. In case of bleeding, swelling or smelling of gums, consult your dentist immediately. Prevention from malocclusion. Prevent the milk teeth from cavities. Prevent children from thumb sucking, mouth breathing and pushing the tongue against their teeth. Please remember, consult a dentist if your teeth are irregular in shape. Prevention of mouth cancer. To prevent mouth cancer, never consume tobacco, cigarettes, gutka, and alcohol. Check your mouth yourself for symptoms of oral cancer. If any sign is visible, consult your dentist immediately. Let me tell you that dental problems do not have anything to do with age. If dental hygiene is taken care of, the teeth can remain healthy for the rest of your life.